kid to hero with a spark in their eye, from kid to explorer reaching for the sky. Every story starts with a little heart today. Sunrise dreams are lighting up the way. Lawyers, engineers, and artists too.
Hi, my name is Araf Perez,
My name is Steven Collazo.
and we are from Sunrise Elementary. Please state, and this is our interview for Career Day. Please state your name and your job title.
Alrighty, my name is Cynthia Lynch, and I am a psychiatric mental health nurse practitioner.
What things did you learn in school for your job?
So I started out as a registered nurse, and I worked in behavioral health. So I worked with patients ranging from teenagers all the way through adults, just individuals who were having trouble with things like depression, anxiety, stuff like that, that they were just having a hard time kind of getting through things and needed a little bit of extra help. So they would come into the hospital and we would take care of them. We would, they would do therapy. We would do some, start them on some medications if they need medications for extra help. And so basically in school, I learned about the different types of medications that we would be giving them. I learned about the different, like some of the symptoms of depression, symptoms of anxiety, some symptoms of, some other disorders that people had, and just basically what we would do to treat them. Now, as a nurse practitioner, I am basically the one that will prescribe the medications. I basically, I see them, I function as in the same role as a doctor. I just didn't go to medical school, so I can't be called a doctor. I'm still a nurse practitioner, but I function in that same role. So they come to me, I meet with them, I talk to them, I, kind of figure out what's going on, and then we come up with a treatment plan and get them going.
Okay, so can you tell me what was the biggest challenge or the hardest challenge you were faced by to get to your job title or your career?
So I think the hardest challenge, school was very challenging. It was, but I think probably the biggest challenge came after school when I was trying to find a job. Sometimes it can be a little bit hard to find jobs in these types of roles. So I basically just started my own practice. So I'm my own boss. I work for myself. I have, I have my own patients, my own office, my own everything. So trying to find a job was a challenge, but then also now starting my own business was a big, huge challenge.
Yeah, I agree with that. It is a challenge to find careers and things they want to follow. Like if your career doesn't success, if you don't have success in your career that you wanted to aim for, then you have to aim for another career that you maybe didn't want to, but you have to.
Right. Yeah.
Is there anything you don't like about your job?
And maybe not so much that I don't like, but it can be hard sometimes working with some of the patients. Some of them have had some really, really big challenges in their lives that I'm trying to help them get through. It's actually a very rewarding part of my job in that sense, but at the same time, it can be very difficult sometimes to hear some of their stories and some of their struggles and some of the things that they've been through sometimes.
Have you ever came home like sad, like depressed, or like felt bad for someone that you've treated or that you've consulted with?
Well, that's a good question. In the beginning, I did. In the beginning, I really did. But you kind of have to learn to, they call it compartmentalizing, where basically I kind of leave my work at my work and home at home, because it can become very overwhelming. A lot of times there's even, therapists and people that work, like I do, that we need to go sometimes to therapy ourselves to kind of process some of the things that we hear, some of the things that the patients tell us, so that we don't start carrying that with us, because it can happen very easily sometimes.
Yeah, it's difficult with your mental health and well-being. That
Yes.
Okay. Is there ever like a day where you feel like you're really grateful for your job? Or is there a day where you sometimes wish you could have had a better career?
I think I'm grateful for my job every day. I always, since I was a young kid, I don't even know where I learned about it from, but since I was a young kid, I always wanted to be a psychiatrist. But psychiatrists are medical doctors. But I function in the role of a psychiatrist, just as a nurse, in the role of a nurse practitioner. But we basically do the same things. We evaluate, we assess, we diagnose, we treat. So in that sense, I'm basically kind of living out my dream job. So I am very grateful every day, and I'm grateful that I am able to make a difference in people's lives. It's huge.
Um, what advice would you give your younger self if you had a chance?
That's a tough question. I think I would just to keep going, just keep going. I mean, I did keep going. I finished later than I would have liked to. I didn't become a nurse practitioner until last year, just because different life circumstances. But I think I would have told myself to just keep going when I was younger and not wait and put things off, so that I could have been doing this for a longer time.
Um, so, what is the hardest mental illness that you will deal with or you have dealt with?
So there's a mental health disorder called schizoaffective disorder, and I think that's a tough one to deal with. So basically, these patients, they have problems with their mood, with like depression and anxiety and stuff like that. But they also have another part of that where their brain basically does not connect properly with reality. So they might see things that aren't really there. They might hear things that aren't really there. A lot of times they feel, like people are out to get them, people are trying to hurt them. So trying to get them to understand that those things that they're thinking and feeling and hearing and seeing aren't real can sometimes be very difficult, because to them it is very, very real. And then they have the depression side to that also, so that can be very challenging.
To the mental illness that you just mentioned, does that mental illness like come at any age, or can it come to ages 0 to older age?
It usually comes out in like the later teens to like early 20s.
Oh, okay.
Yeah.
Do you treat all age groups?
I do. I think my youngest patient right now is 6 years old. Yeah.
Can you tell us about your educational background?
So I have a master's degree in nursing with a specialty in psychiatric mental health nursing practice. Yeah, so it's a master's degree. You can go for a doctorate, which I thought about, but I think I'm going to wait a little bit for now. So just focus on my practice and my patients for now.
It's a really good degree.
So what helped you get your job in school? What careers helped you get your job?
What was that?
What skills did you have to learn on what skills did you have to learn to achieve your career?
So because we start as nurses, we start as like a regular nurse that you would see when you go to the hospital or to a doctor's office. I actually started out, like I said, working in behavioral health. But then I did work in the emergency room for a long time, close to 12 years. I worked in the emergency room. So we learn regular nursing skills, how to give medication, doing what we call like a head to toe assessment, basically kind of, checking you from, like, it sounds like from your head to your toe. We would check your eyes, your mouth, your ears, listen to your heart, listen to your lungs, listen to your belly, just kind of make sure that your whole body is good. We give medications, we start IVs, we draw blood. But then as a nurse practitioner, we don't really do any of that stuff anymore. So the focus becomes more on, evaluating and diagnosing like a doctor would. So my education as a nurse practitioner was focused more on what the disease looks like and then how we would treat it.
What would you rate your job from 1 to 10? If you would be able to rate it on a scale of 1 to 10.
About like how much I like it.
It could depend. You could say how much you like it or how much you don't like it.
Okay. I think I'll rate it on how much I like it to keep it on a positive note, but I'd say about an 8.
That's pretty good.
Yeah, I do. I really, really enjoy what I do.
Can you describe a typical work day for you?
So a typical workday. So I actually work from home. I have an office in my house. So I basically come into my office. I have an assistant that works with me that helps me, keep track of all of my patients, scheduling their appointments, making sure all of their paperwork and everything is done. I'll just kind of print myself out a little schedule for the day of all the patients that I have to see. And then I see them the same way that we're kind of meeting right now. We meet through, it's called telehealth. So, they get an email with a link and they sign in. I talk to them. We just kind of talk about what's been going on. If it's a brand new patient, I do a full assessment. I get, all of their history, starting from when they were very young, kind of things that they've been through, all the way up to what's going on with them now. And then we come up with a treatment plan. Sometimes we don't come up with a treatment plan right away. Sometimes it takes a couple of visits to find out exactly what it is that's going on with them. If it's a patient that I've already been seeing for a while, I basically just check in with them, make sure that they're taking their medication okay, that it's not making them sick, that it's controlling their symptoms, whatever it is that we're treating them for, and just making sure that it's working well for them. So I see anywhere from probably anywhere from I think on my lower days, which I don't have too many of, I'll see maybe 3 or 4 patients. And then on my heavier days, I can sometimes see like up to 16 or 18 patients in one day.
What advice would you give a student who is struggling with their mental health, anxiety, or depression?
Don't be scared to reach out for help. There's nothing wrong with asking for help. Everybody goes through things, and I know sometimes a lot of people make it seem like if you ask for help, you're weak or there's something wrong with you or anything like that. Having a mental health illness is not anything wrong with a person. It's just our brains, everybody's brain works differently. And sometimes people need a little bit more help than others. And taking care of your mental health is the same as taking care of your physical health. If you have a cold, if you have, pneumonia, if you have COVID or anything like that, you're going to go to the doctor and you're going to get help. And I wish people would see mental health that way more than they do. That if you're sad, if you're anxious, if you're, feeling any other way, that you would go and you would get help. And there's nothing wrong with it.
How has your job affected your personal life?
I don't let it. So in the beginning, it did. In the beginning, especially, like I said, because I was running my, starting my own business. So it did take a lot away from my personal life and my family life, because I had to basically start from the bottom. And, I had to come up with all of my own paperwork, how I was going to run my business, what kind of patients I was going to see. I had to, set up so that I could accept health insurance or patients that were just going to pay cash out of their pocket. So there was a lot that went into it in the beginning. But I was noticing that I was letting it affect my personal and my family life a lot, and it was taking away from that. So I've really cut back on how much I let that happen. And I've just kind of set times for myself, even outside of the times that I'm seeing patients. I've set what I call like administrative time, where that's my time that I'm going to do paperwork or anything else that needs to get done. And then once that's done, I'm done for the day. I try not to let it spill over.
How do you decide if someone needs to go to the hospital?
So usually if somebody has to go to the hospital, that's because they're either they're a danger to themselves, where they're threatening that they're going to hurt themselves, or they're threatening that they're going to hurt somebody else, or they're just not able to take care of themselves. They're not able to, feed themselves, bathe themselves, anything like that. Those are typically patients that are very unstable and that would need to go to the hospital to be evaluated a little bit more.
What careers have you had before this one?
So before this, I was working as a registered nurse, mostly in the emergency room. I did work for a little bit as in behavioral health as a nurse. And then at very, very early on, I worked as what's called a psychiatric technician, where basically all we do is, I mean, not all we do, but we just give patients medication and just kind of make sure that they're safe and that they're not, hurting themselves or hurting anybody else. But I did that in the very, very beginning. And then I became a registered nurse and worked in behavioral health and the emergency room.
Okay, so have you ever dealt with a patient or a patient that hasn't been able to pay like the 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 fee that you guys charge? Like if you guys charge any fee?
I have actually, and I try to work with people as much as I can. Unfortunately, it is a business and this is how I get paid. So, I do have to get paid, but if patients aren't able to pay, or even if they're not able to pay right away or they can't pay the full amount, I will try to work with them the best that I can just so that they can get help.
Okay, so what would you describe like a patient that's like just like doesn't have right mental health and like illness in mental? Like, what would you describe a patient with mental health problems and a patient that's like suicidal, if you would be able to describe that?
So usually, a lot of times there's signs. So it's very important because it can look very, very different in everybody. So mental health illnesses will look different in every single person. So if I was depressed and both of you were depressed, it's going to look very different. So you have to be very careful that you don't like generalize and just say, oh, well, this person doesn't look suicidal, because there's nothing that looks suicidal. It can be very, very different. There are some people that won't say anything at all. And then there are people that will say like, hey, this is what I'm going to do. And this is when I'm going to do it. And this is how I'm going to do it. And it's very important that we take all of those all of those statements very, very seriously and just really discuss them very in depth with the patient. A lot of times I try to get what's called a release of information, which basically allows me to talk to like other members of their family or whoever it is that they let me talk to, so that I can make sure that they're safe, or talk to them and see if they have seen any signs of something that this patient might be suicidal or anything like that, because it looks very, very different from person to person.
What helped you find the career that is right for you?
I think I think not being able to get a job was actually very, very helpful for me, because it really pushed me into being able to work for myself. I think if I would have gotten a job with somebody else, I would have kind of gotten stuck in, that clinic or, hospital or wherever I may have ended up working. So I think the difficulty finding a job is what helped me to push me to be where I am right now with my own practice.
What are 2 skills that are needed to apply for your career or job title?
So skill wise, you mean like aside from like so education wise, you would need a master's degree and then you need to be board certified. But then as far as skills, you need to have very, very good listening skills and very good assessment skills. Like you have to be able to look at a person and, kind of see, you have to be able to look at them and kind of see what type of state they're in, because looking at a person gives you a lot of information about them. Like if I meet with a patient and I can tell that they haven't showered, I can tell that they haven't changed their clothes, I can tell that they haven't done all of this stuff. Those are big clues to me that maybe this person is feeling very depressed or feeling, like they're just not wanting to take care of themselves. And then also listening, because sometimes patients will say things indirectly, and I have to be able to pick up on what they might mean and just kind of ask more questions to get a little bit more information out of them.
What, like you mentioned, like you have multiple skills, but what type of training did you take, like in college, to get to this career, and what skills did you have to learn forcefully to be able to reach your career?
So some of the classes that we took were so like we would take a lot of like neurobiology classes, like how the brain works, how the they're called neurotransmitters, like the chemicals in the brain, how they work and how they affect what we do, how we feel, whether we're sleeping, whether we're eating, all of that stuff. We had to take classes in pharmacology, again, also that tell how the different medications work in our bodies and the effects that it can have, both good effects and bad effects, because sometimes even when we give medications to help somebody, sometimes they could make things worse or they could even cause different problems. So we have to kind of know how all of that works. We do take some classes in like counseling and therapy, just so that, we really don't do therapy. But sometimes there are patients that will kind of open up and want to talk about things, and we have to be prepared to be able to kind of talk them through some of those things. And then basically just knowing how the body and the brain work.
Well, thank you for having time for you to answer questions about your career and job title. We really appreciate you being our special guest, and have a nice day.
Thank you.
From
All right, thank you
kid
for
to
having me.
hero with a spark